care on the resident provides many benefits for all patients. The overall goals and benefits of oral care are to remove food particles and plaque because it's a buildup that can promote bacteria growth, cause gum inflammation, also known as gingivitis, and further infections that can cause dental decay. Oral hygiene will keep their mouth moisturized, will promote healthy gums and teeth, refresh the mouth to promote resident appetite, and it will allow the CNA to observe the mouth for any signs of problems. The basic guidelines in providing oral care to a resident are providing mouth care 2 times a day, regardless if the resident has teeth or dentures, following standard precautions of wearing gloves throughout the process of oral care with contact fluids, set up all the supplies essential in providing oral care to encourage residents to do as much as possible on their own, and being able to recognize situations in which some residents may need more help or more frequent oral care. When providing dental care to residents with teeth, there are some techniques that we need to follow. We always need to remember to use soft bristle brushes. When brushing the front teeth, we are going to brush at a 45-degree angle with short strokes from the gum to the crown of the teeth. Just like this. Alright, ma'am, can you open your mouth for me? Alright. We're going to go like that. And then we're going to go in at a 45-degree angle, just like that. And we're going to proceed to do that on the other side. Obviously, after adding toothpaste and minimal water. And then we're also going to do the same thing at the bottom at a 45-degree angle. Always brushing from the crown to the gum. Alright, ma'am, can you stick out your tongue for me? We will also proceed to brush their tongue and the roof of their mouth to prevent any plaque from escaping and staying in there. Hold on. When brushing the horizontal surface of the teeth, we're going to brush at a horizontal angle in order to be able to get any plaque that might be accumulated there. When brushing the resident's biting surface, we will provide back and forth strokes on the teeth, just like this. Whenever providing oral care, we must not forget about flossing. It is an essential part of providing oral care for the patients. In order to properly floss the resident's teeth, you're going to wrap floss around the middle finger, and you're going to move the floss in an up and down motion between each teeth from crown to gum. Obviously, you have to be wearing gloves, but I couldn't find any at home, so we're just simulating that I have gloves on. And you're going to go from top of the teeth to the gum, just like that, on every single tooth, in order to ensure that there's no food stuck in between their teeth. Residents with denture will require a whole different procedure of oral care. To remove a resident's dentures, which is usually done at bedtime, you have to grasp the dentures with your thumb and index fingers and use a gauze if it is slippery. Obviously, I'd be wearing gloves, but for the simulation, I will not be. So we're going to grasp and remove right before bedtime. To insert the upper dentures, hold the dentures down with your hand firmly while raising the resident's upper lip with the other hand and inserting the dentures up like this. Obviously, the dentures will be separated, and the bottom dentures will go in separately, the same way by holding the bottom lip. To properly clean the dentures, you will brush the outer surface with a back and forth motion while holding the dentures over a sink filled half easy with water. In this case, I'm using a cup full of water in which I'm going to be brushing the dentures at the top, the back, and then simulating that this is the bottom. We are also going to brush that and that. Obviously, real dentures will be separated and will not be connected just like this model. To brush the inner surface by positioning the brush vertically with upward strokes, just like this. Or like this. Dentures should always be stored in cold water because hot water distorts the denture and may cause it to change shape. Unresponsive patients also require oral care. To prevent aspiration, we would have to position the patient's head to one side, making sure it is turned all the way to the side to allow the fluid to easily flow out. We also have to make sure to use a small amount of fluid. In this case, I'm representing my padded tongue blade with the toothbrush, and this is going to be my cup of Brolo fluid. We are going to start by turning the patient's head to the side, and then continuing to brush, same oral care we have done on regular patients, but with the padded tongue blade. Alright, so we're turning the patient's head to the side, and this is my padded tongue blade, and I'm going to go out at 45-degree angle softly, using minimal fluid. We're also gonna brush the tongue with the padded tongue and the roof of the mouth. We should also keep in mind that we need to frequently moisturize the lips and mouth of an unresponsive patient, and that dentures are not worn by these unresponsive patients, so there is no need to clean them in this case. We should also always wear gloves when performing any oral care on any unresponsive patient, or any patient in general. The bed should always be protected with a waterproof cover at all times when performing oral care. For resident nail care, CNAs are required to follow facility policy and procedure for nail care. Only the nurse in charge will decide which patients need to have their nails trimmed. Nails are always properly cleaned and trimmed during bath time. The appropriate tools and supplies based on the patient's care plan will be used, such as a file to shape the nail, and nail polish can be applied if desired by a resident. CNAs are required to observe a resident's nails and report any problems within the nail cuticle or within the skin around the nails, or any problems in general, to the nurse in charge. Only the nurse or the specialized doctor can trim the nails of patients who have diabetes or poor circulation. This is in order to ensure their safety and to make sure that there's no cuts or any wounds that could occur when cutting or filing nails. During the shower, the nails will be cleaned under and above, making sure that there's no dirt and making sure that there is no open wounds. All nail care performed on a resident should first be approved by a nurse.